going to go ahead and get started. Welcome everyone to this month's COSSA Headlines. We're thrilled to have you with us in these interesting times. I will apologize in advance for any background noise of the child or dog variety. It's also incredibly windy in the DC, Virginia area right now. So if you hear any rattling, that would be my windows. But we are going to press on, and thank you all for joining. We have a great turnout today. And no doubt because of the topics at hand that we're all dealing with. We're going to try to stick with our usual 1 hour duration if we can, but given that we're all working remotely these days and we have some flexibilities, we really do want to hear from you all and your questions and comments. So I know I'm able to stick around a little bit if folks want to discuss later on. But let's dive in. If you're new to COSSA Headlines, just to give you a quick sense of what this is. COSSA is an organization that tries to get information both out to the research community, but also to hear from you about what's important. And so this is a way to open up two-way dialogue between our staff, who looks out for the policy and funding interests of the social behavioral sciences, and then from you all, from your various perspectives where you sit, what's important to you all. So we're going to start with some quick headlines of just some of the information that we think you need to know about what's going on and what's been happening over the last couple of weeks, both related to COVID-19, but otherwise as well. And then we're really lucky to have with us a very timely deep dive topic on communication strategies in an emerging public health crisis. And we have two colleagues with us who I'll introduce in a couple of minutes. And then we like to end each month with a homework assignment, things that you can do to stay engaged on some of the topics that we've gone over today. So that's the outline for today. So you know there is a chat box. So we use Ring Central, but it's nearly identical to Zoom, which we've all, I think, gotten very used to using over the last couple of weeks. So go ahead and submit any questions you may have through the chat box at any time, either related to the headlines topics or to our deep dive topic. But at the end, once our colleagues have gone through their presentation, you can unmute your lines and ask your questions that way as well. Okay, so with these housekeeping items out of the way, let's turn to what we think are some of the top headlines happening related to social and behavioral science. Obviously, COVID-19 is on everybody's minds. And I'm sure you've all been hearing on the news and some maybe more than others following some of the details of the supplemental funding that's been happening over the last month. We provided an analysis of the 3 supplemental appropriations bills that have been enacted since early March, and you can find that on our website. And we go into detail specifically on the 3rd bill, the most recent one, because that is the one that includes additional funding for federal agencies and departments that our community cares about. And I think what's interesting about that piece of legislation is for each of the agencies included, the bill includes almost identical language directing the use of those funds. And I don't have the direct quote in front of me, but essentially to research the coronavirus and with an eye towards sort of ending the pandemic, whether it's the Department of Energy or it's NSF or NIH. So that really gives a lot of leverage to the agencies and flexibility to use those funds as they see fit for their specific missions. But I mentioned that also because it's important that as agencies who are receiving these additional funds start reaching out to the research community, you'll want to sort of hear from the agencies what they're prioritizing, since they do have flexibility to make those decisions, and use this as an opportunity to express from your perspective what you think are the immediate research, infrastructure, technology, data needs in light of the current pandemic. It's also worth noting that these appropriations supplements are just that. They're supplements for fiscal year 20. So that's what the year we're in now. We don't know yet, if fiscal year 2021 appropriations bills will be completed on time. I'm guessing not. But we don't know how this supplemental current year funding will impact any potential increases for science agencies for next year that begins on October 1st. So stay tuned to our coverage there in our Washington report and on our policy page, which is linked on your screen, as we'll be watching very closely what the impacts of this additional funding is on sort of more regular appropriations down the road. Okay, also related to COVID, some of you may, if you're in the Beltway in particular, may have received an email this week from the House Science Committee, which has broad jurisdiction over NSF, National Institute on Standard and Technology, DOE, essentially the non-health, non-NIH science agencies. And they're very interested in hearing from the research community about what the needs are, both for what are sort of opportunities for research relative to coronavirus, but also where are some of the troubles, whether you're in a university or a lab, a federal lab somewhere. What are sort of the infrastructure struggles that you're dealing with right now? Are you worried about students, fellowships, postdocs, international students? They want to hear if there is another supplemental that could have a significant science piece to it. The Science Committee wants to hear these ideas and start getting something organized so that they're ready to pull the trigger if the opportunity presents itself. So on the link, at the link on your screen there, we just pulled the text from the email that went out that asks very specific questions that the committee wants to hear about. And they're seeking input by Monday, next Monday, which is a short turnaround. But I'm sure that there is some flexibility there. That is not because there is another supplemental happening before, next week. But they do want to be able to have something as cooked as possible and really hear from the community. So I'd highly encourage you to take a look at the questions that they're asking and to consider submitting some ideas about some of the things that you think are important as we get through this crisis together from the scientific community perspective. Okay, changing gears for a second, there are other things happening in Congress and federal agencies in Washington that are not coronavirus specific. A piece of good news is in early March, Congresswoman Eddie Bernice Johnson and Ranking Member Frank Lucas, so the top Democrat and Republican on the Science Committee, the same one seeking information on COVID-19 from the research community, they introduced bipartisan artificial intelligence legislation. And this is one area that COSSA, our staff in particular, has been hearing a lot from the Hill because they recognize that there is social, behavioral, ethical components to artificial intelligence. And so this piece of legislation, it's just introduced. It's not law. There's no Senate companion yet, as far as I know, but it's very pro-social science. It includes many opportunities for agencies to support research on the social and behavioral dimensions of artificial intelligence. And it really emphasizes the importance of understanding social, ethical, and economic implications of AI. So that's another good sign, I think, for leaders, science leaders in the Congress who really do care and understand the social sciences. So I want to flag that legislation for you, and we will be watching it certainly going forward as it makes its way potentially towards becoming law. Okay, we'll turn over to some executive branch news. Again, also outside of sort of coronavirus news, there's a changing of the guard that has, already happened at the National Science Foundation. France Cordova has been the director there for the last 6 years, and her term ended in March. There is a nominee that needs to be confirmed by the Senate, Sethuraman Panchanathan, who's on the National Science Board, and we are very supportive of his nomination, but given all that's happening in Congress, Senate confirmation is highly unlikely sort of in the immediate near term. So interestingly, the director of the White House Office of Science and Technology Policy, Kelvin Drogemeyer from the University of Oklahoma, has been named acting NSF director until a permanent director is confirmed by the Senate. This is incredibly welcome news for those of you who have been following our reporting or are in the DC area, Dr. Drogemeyer is a huge proponent of social and behavioral science. He's been on the National Science Board. He was vice chair of the National Science Board, and in that role has been a vocal advocate for our sciences. He's a meteorologist by training, and he really understands sort of the social behavioral side of the weather enterprise in particular. And he's been a friend of COSSA for a really long time too. So this is good, good news as we're in sort of murky waters otherwise, to make sure that we have some very supportive folks in important places, serving as a caretaker for an agency really important to us over the next, what could be the next several months. So we shall see. NSF, NIH, all of the agencies that we care about have created resource pages for COVID-19. Hopefully you've checked out some of those and have been seeing emails from the agencies directly about those. The NSF one is of particular interest. It includes really, I think, important FAQs about NSF awards, current awards, and what one can expect if you have an active grant. And there's also a Dear Colleague letter inviting research proposals through their, what's known as their RAPID program, which is a way that they can get out funding for, through sort of abbreviated peer review, to get research into the hands of researchers who can answer questions that we need answers to right now. So it's very timely. Interestingly, unofficially, I heard reports from NSF that, about a week ago or so, that at the time about 800 or so rapid proposals had been submitted to NSF around coronavirus, and at least 60% have been from the social and behavioral sciences. And that was seen as incredibly good news. The agency is fully embracing social science right now. It takes a crisis sometimes to really put a spotlight on the value of the work that we do. But I think it's an important time for our community to shine, and the data is starting to back that up in terms of rapid grants and proposals and really interesting ideas coming from the community in need of funding. So that's great, and keep that up. They're still soliciting, still accepting proposals for rapid projects. So keep that in mind as an opportunity for you and your communities. Also, just wanted to note, and I'm sure it shouldn't come as a surprise, but the Census Bureau, we are in a census year, and we've spent the last several years getting ready for this moment for the 2020 census. None of us anticipating we'd be in the world that we are in now. We have provided information on our website and our newsletters about what the Census Bureau is doing in light of the crisis. So they're temporarily suspending 2020 field operations, really pushing hard on self-reporting through the web terminal. I know I've submitted mine. I hope you all have too, and share with your constituencies that census is obviously important for so many reasons, especially for social and behavioral science, because we need that data. So you can follow what the census is doing on their website, or follow our reporting as well to see how things change as we try to do this count. Okay, something we wanted to pull out, it's not coronavirus related at all, but it's incredibly important. And that is, there is funding from the National Institutes of Health, specifically for firearm injury research. As many of you may know, like a lot of federal agencies, there are restrictions from Congress on using federal funds for certain activities, such as advocating for gun control policies. But in the 2020 final appropriations bills that passed last year, there was a little bit of money, $12.5 million included in there for NIH to conduct some firearm injury research. This is huge. It's not a lot of money, but it's important that this funding was provided at all. So what NIH is doing in response, they've issued a notice of special interest, which solicits competitive revision applications for programs that could potentially include firearm injury and mortality prevention research. They are particularly interested, and of course they have to walk a tightrope here about what they can solicit research on. But some of the topics that they are interested in are improving the ability to identify at-risk individuals for firearm injury and mortality, developing healthcare procedures to accurately screen for risk of firearm injury and mortality, understanding factors that are associated with firearm injury, developing evidence-based interventions to address risk. I mean, obviously there's some gaps here in what we would love to study related to gun violence and mortality. But again, this is an important sort of marker for something that the agency can do. So please do pay attention to that. The applications are being accepted through May 15th, so you have a little bit of time. But we didn't want this particular opportunity to get crowded out of all of the other things that are happening, because it is quite remarkable that we have this opportunity right now. Okay, a few quick notes from the community, so leaving the government for a minute. The National Academies is seeking a new program officer for the Board on Environmental Change in Society, and that's one of the many boards at the Academies that does a lot of work in the social and behavioral sciences. So we wanted to flag that for you all if you know of anyone sort of currently on the hunt and wants to do some sort of research / policy relevant work in Washington. That is an opportunity. And then to highlight for you just a couple of things happening at COSSA. Like a lot of your organizations, like federal agencies, we are trying to compile what we think are the most important COVID-related resources for you. And so we have a dedicated webpage right now, and the link is on your screen there. We're collecting the resource pages for the agencies that we care about. If there are other, our analysis of the stimulus is there. If there are other web pages from sort of outside the government that are looking at relief for associations or university issues that are happening related to all of this, we're combining, we're collecting all of that for you, but it's an incomplete list. We don't want to post everything, but we do want to make sure we don't miss anything that's incredibly important. So if you take a look at that and you see there's nothing on a very specific issue or concern that you have, do let us know, because this is being updated daily as things are moving quite quickly, as one might imagine. And of course, we like to highlight, if you don't receive it directly in your inbox, hopefully you do, when we put out a new Why Social Science post. This is our way to talk about social science and invite sort of bloggers to write for us and contribute a piece about how social science is impacting everyday life. And so this month we have an anthropologist who's talking about how anthropology contributes to our understanding of the impacts of financial systems. It's a very interesting piece about sort of electronic currency versus cash and paper currency, but also makes the connections to how this is a really important issue, especially in times of global pandemic, and makes the case to coronavirus. So I would invite you to check that out and share that with your communities as well. And finally, we like to just announce anytime we have a new member of the family, and so we're very pleased to welcome Case Western Reserve University back to the COSSA family, and of course, welcome all of you to send any ideas you have for potential new members who can join our cause going forward. Okay, so our monthly headlines are a little bit longer this month, and I blame entirely all of that on coronavirus, and there's so much to talk about. But I don't see any questions at the moment in the chat box, and that's fine. You can submit them at any point on any of the topics that I went through incredibly quickly, and I will get to them later or by email as well if you want to follow up. But I don't want to take any more time away from our invited guests. So we are very lucky to have with us two colleagues who are going to talk to us about risk communication, which I think is couldn't be a more timely topic. We're very happy to have with us Lakeisha Anderson, who is Director of Academic and Professional Affairs at the National Communication Association, which is one of COSSA's governing members. And so Lakeisha is a very great colleague of COSSA, but she's also an active researcher through her work at Johns Hopkins University. And her focus is primarily on women's health and risk communication, with specific attention given to postpartum mental health issues. And she's joined today by her collaborator, Christy Ledford, and she is an associate professor in the Department of Family Medicine at Uniformed Services University of the Health Sciences. There she also serves as a research director for the Military Primary Care Research Network. She too is a communication scientist, and she works to integrate communication principles into medical education and clinical practice. And so together they're going to give us a little bit of a preview, I think, about some of the work that they're doing, which just happened to be incredibly timely, but I think we're all the better for it. And then they, I believe, are going to leave quite a bit of time to hear your thoughts as well. Before I pass it to them, I want to say that in light of the coronavirus, we are trying to do more sort of promotion of social and behavioral science research of particular relevance to the current crisis. And so I'll mention later, but we are hoping to do headlines more frequently, perhaps every other week, with a focus on a different social and behavioral science discipline or field or project related to the topic. So if you have ideas, today we're focusing on communication, but if you're in another domain, education or sociology or statistics, do let us know, because we want to get this information out as quickly as we can and make sure it's timely. So without further ado, I am going to turn things over to Lakeisha to get us through today's topic.
Hi, thank you, Wendy. Thank you for having us today. Welcome to everyone who's on this call. We're grateful to be here and to talk a little about our work and how it relates to what's happening in the world today. And it never hurts to have a little human interaction, given that we're all cooped up indoors right now. I know our time is short. We want to leave time for questions at the end, so we're going to dive right in. You'll hear both from Christy and I at different times, but Christy's going to start us off with a quick introduction to what we're going to talk about today.
Thank you, Lakeisha. Many of us first started hearing about novel coronavirus before the new year. We were reminded then of SARS, and we were reminded of H1N1. But it wasn't until February that our team recognized the need for creating guidance and for direction for the medical community. One of the first populations we considered was family physicians from my department. These are our primary care physicians who practice on the front lines in this pandemic every day. Our first publication from that work is actually going to be released May 1st in the journal Family Medicine. And today we're just going to talk about some of the theory and ideas that guided that publication. A recent application of risk communication strategies targeted physicians during public health crises. It is framed by risk communication theories and models. Every day in the current pandemic, we have leaned on these theories and models to guide practice. Whether it's when I scripts for communication, for delivering test results for our physicians, or when I start to coach physicians about how to talk to patients about the uncertainty of COVID-19 testing. Today, though, rather than talk about how it applies to work in our own worlds, we want to take a step back. We want to generalize these ideas. Our goals are: 1, you learn something new about these underpinnings of risk communication, and 2, you discover how risk communication can be applied in your discipline. The frameworks we're going to talk about have implications for how lay audiences talk about, understand, and respond to risk, and how we as social scientists develop communication strategies during risk events like COVID-19.
Thank you, Christy. Okay, so the first model we're going to introduce you to is the COSS model. You can see that on your screen here. This model was developed by Kathy Rowan at George Mason University, who was our risk communication professor when we were doctoral students. Kathy studies message design in health, risk, and public relations context, and she's done extensive research on how to generate awareness and deepen understanding of risk messages. Her models can be used for developing communication strategies in a variety of risk settings and has been used in developing communication and behavior strategies for cancer, climate change, and water risks. COSS is an acronym that stands for the 5 steps of the model. The C refers to confidence or credibility. The A stands for awareness. The U refers to understanding. The S stands for satisfaction with a suggested plan, and the E refers to enactment of the plan. We're going to explore each of these components, what they mean, and talk through some ideas for doing each of these steps. When thinking about confidence, it's important to think about who the most credible communicators are in an organization. Communication scientists have studied credibility for more than 50 years, and over that time, they've discovered that credibility is based on trustworthiness and expertise. These traits you may also know as character and competence. We tend to have more confidence in messages provided by a credible source. In the healthcare context, this is likely a physician, as they have the trust of their patients and they are also viewed as health experts. This is also supported in a recent Pew study that found that 74% of Americans have a favorable view of physicians. When thinking about messaging, there are two primary goals: creating awareness and deepening understanding, the A and the U of the model. Awareness is exactly what it sounds like, making people aware of a risk. The first issue is ensuring people can differentiate risk from risky behavior. In the case of COVID-19, the risk is exposure to the virus, and risky behavior, such as not washing your hands, increases chances of exposure. It isn't as easy as just telling someone the risk exists, though. Several issues need to be considered when developing awareness messages. In the instance of a pandemic illness, the initial awareness step is to ensure people know the risk exists and what the risk actually is. This can be easily hindered. Using jargon is common amongst experts, and doing so can prevent non-experts from truly hearing the message. Language barriers can also create issues in making people aware. Some suggestions for improving awareness can include things like making messages simple and easily visible, and assessing what people already know about a risk. Understanding is a step beyond awareness. Understanding is helping individuals understand the processes, concepts, terms, and numbers that can lead to a fuller comprehension of the risk. When people begin to process a risk, they tend to compare it to risks that seem familiar. So it's important to provide true comparisons. What is the risk and what is it not? In the instance of COVID-19, we see many people making a comparison to the flu. It is up to credible sources to push back on that and provide real examples of what the risk is and isn't. People also find it difficult to understand numbers. It's important to remember that when providing statistics, it is better to use visual aids. For instance, rather than saying 60% of people, it may be better to show what 60% looks like visually, perhaps by lighting 60 bulbs on a set of 100. Even while people may understand visual representations of numerical information better, COVID-19 has presented an excellent case of visual representation. Each day, we see complex charts and tables and figures both online and on TV. For some people, these graphs improve understanding. This is mostly true for people who appreciate quantitative facts and details, but the constant presentation of graphs may also introduce some bias or misunderstanding. Many of the graphs we see experts discussing on television are created on a delay. The information used to build a visual is retrospective. Rarely is that information available in real time. So it remains important to have discussions about how to read visual information as well. Once people are aware of and understand a risk, we can begin to move towards making recommendations for how to manage the risk. People often underestimate risk when it seems familiar or voluntary or avoidable. At the same time, people tend to overestimate risk that seems imposed on them, which can lead to feelings of helplessness. The goal here is to recommend a plan that people feel satisfied with. If risk is underestimated, people will be less inclined to follow risk guidelines. If risk is overestimated, people will likely respond more emotionally and may be unable to follow a plan because they feel panicked, confused, and/or angry. So the goal is to make a plan that can be followed and that matches the real risk response. When a credible communicator has explained the risk and offered reasonable suggestions for avoiding the risk, advice is much more likely to be followed. Finally, motivating enactment really depends on two factors: self-efficacy and response efficacy. Self-efficacy refers to our belief that we can perform a behavior, for instance, wearing a mask or staying indoors. It asks someone to assess whether they can perform the suggested planned steps. Response efficacy is the belief that taking a specific action will be effective in avoiding the risk. It causes people to ask, if I follow this plan, will it be effective at helping me avoid the risk? One way to build advocacy is to make the first steps small and easy to do, adding harder steps once simpler tasks are mastered. It is also important to be aware of when people are most likely to be receptive to a suggestion. For instance, when a friend or loved one contracts COVID-19, it becomes real to someone and they're more likely to pay attention to the risk message. The COSSA model provides a linear way of thinking about how to motivate public behavior in response to risk. But the world of risk and human behavior isn't always so linear. So Christy's going to share some more information about the wider context of the thinking about risk communication.
Thank you, Alicia. Kathy's work certainly inspired us both. As much as I wish we could follow those steps and save everyone from risk, I also know we live in a far messier world. When we look at Peter Sandman's work, which you see on your screens now, his work on risk communication, we see the push and pull of other factors. Risk communication basically serves two primary functions. Number one, to alert people. Number two, to reassure them. Much of my research looks at how these two functions occur in family medicine. I help physicians alert and reassure expectant parents about childbirth decisions, new parents about childhood vaccines, and adults about cancer screening choices. To talk about risk communication, we need to talk about two big ideas: hazard and outrage. Hazard is the physical risk. That's how scientists and experts understand physical risk, how we describe it, how we make sense of it. Outrage is the public's perception of that risk. A person's first response to a hazard is usually going to be emotional. When we approach the edge of a cliff, we usually feel stress and anxiety. We're at the precipice of a great height. Then we might start to step back and start to reason how falling from that specific height can harm us. But our first response is out of fear or confusion. This can lead people to express outrage over a hazard while simultaneously misreading the hazard itself. As risk communicators, we aim to manage the hazard and address the outrage. As millions of people today find themselves under stay-at-home or safer-at-home directives, managing outrage is even more important and difficult. Each day we sit in our house, we rely on our internet connection to the outside world. People have even more opportunity to be exposed to information, but also to misinformation. On our feeds today, we've received messages about COVID-19, a presidential election, the census. I've gotten tips about how to dye my hair at home, how to make bread. But along with the COVID pandemic, we're experiencing an infodemic. An infodemic is an overabundance of information, some accurate and reliable, some that is not. This overload of our processing ability makes it hard to know what sources are credible, and this has been complicated by isolation. Apart from the face-to-face social systems that we usually use to sift through daily information inputs. Usually we go to work, we gather around the water cooler, we talk about what we heard or scrolled through the night before, and then we rely on each other to question and wonder if something we said is true or if it's valid. But now we're at home. We're with like-minded people, likely isolated from challenges to rumor. One strategy against misinformation is inoculation. We can take preemptive communication strategies to inoculate the public to misinformation. FEMA has recently just started doing this in response to the rumors about the National Guard and curfews across state lines. As risk communicators, we need to be smart about what myths and misconceptions are bubbling to the surface, and we must address them. In the past 25 years of wrestling with the anti-vaccine community, if we haven't learned anything else, we've at least learned that ignoring anti-scientific rhetoric does not make it disappear. In the context of a viral pandemic, public outrage will be greater when the illness is unfamiliar, when there is some memorability of a past pandemic illness, when illness spreads quickly or deaths occur frequently, and when uncertainty surrounds the illness. In this current pandemic, we see all of these. It's new. We are not familiar with it. Each day we hear about the spread of the disease and the death count, and every day, rather than a simple answer, we find more questions. It adds to the uncertainty surrounding the spread. Outrage can impede the public from hearing risk messages clearly. High outrage reduces objectivity, but it can also motivate action. The internet, particularly social media like Twitter, enables the public to hear about physical hazards more quickly than ever, even before scientists fully understand the transmission or impact of a disease. Over the past 3 months, I'm sure many of you, like us, have been following WHO or the Johns Hopkins counters. Today, we see constant updates on the facts and figures of the disease. In the past weeks, we've even started seeing zip code level data. I can go online, I can put in my zip code, and I can see how many people who live near me are test positive and how many have died. Although this information is intended to be helpful, when people are outraged, they're less likely to listen to that hazard data or read those charts. I know, this sounds contrary to what Lakeisha said earlier. She recommended use charts and graphs to help the public understand the risk. What I'm saying here is not intended to be contrary. I want to be complementary to what she said. We need to know that when outraged, people are going to respond emotionally. They are motivated by feelings of panic and dread. Well-designed, color-coded curves may not have the power to calm them. We should make the charts. We should share the charts, but we cannot rely on them alone. What is important to remember is that outrage is not inherently good or bad. An outraged public can help mitigate risk. High levels of outrage shine a light on serious risk. The goal is for the level of outrage to align with the seriousness of the hazard. We're dealing with this now in communities where they're not seeing the same numbers that we're hearing about on the news in New York. What can we do that influences how the public responds to a hazard? Okay, let's talk about some strategies, and hopefully I'll echo what Lakeisha has talked about. First, build trust. The COSSA model starts with the cornerstone of confidence. That is key, and that is essential. The public's perception of a hazard will be dependent on how much they trust the information they're receiving, who the messenger is. 3 specific tactics will help build trust. 1, we should legitimate dread. We should always recognize and respect the public's emotional response to hazard. Fear and dread is a reasonable response. This is a scary situation. We cannot be naive. We cannot be too proud to think that we can reason someone out of fear. 2, we need to take catastrophe seriously. As scientists who understand the hazard in a quantifiable way, it is important to remember that each of those data points, that point represents a person and their family. We need to approach hazard respectfully and seriously. 3rd, we must stand ready to respond to the public's concerns and questions. Each time we are asked a question and we respond, we communicate that we care about that person's perspective and we respect that they have questions that maybe I didn't think about. Lakeisha also talked about awareness and understanding. 2 additional tactics can address these goals. First, we can make the risk seem more familiar. The challenge is to make a risk seem familiar without oversimplifying or misaligning the risk. Lakeisha talked about how with COVID-19, it was initially tempting to describe the virus and how it was similar to seasonal flu. I've just talked to a physician on Tuesday about how our clinics are explaining COVID to patients with the words flu-like symptoms. But we're starting to see that comparison may be misleading. It may have contributed to the public's underestimating the hazard. It's hard to know what we could have done instead. We choose that term, flu-like symptom, because we commonly use it. Our physicians use that as a shortcut to describe a very long list of symptoms that most people are familiar with. Maybe we should have clarified that this virus may look like the flu at first, but then becomes much worse, much faster. I can't claim that that would have prevented the misperceptions we're seeing now, but we need to be aware of the power of making a risk seem too familiar. Second, we can increase knowability. This is likely the toughest of all the recommendations we're going to make for you today, because most of us and many scientists around the globe are still investigating just what we know about COVID-19. In this case of an emerging novel virus, we need to stand ready as social scientists to say what we know and what we don't know yet. Yes, I know this is a struggle among ourselves. We debate our own epistemologies. We debate what is knowable. It's far too long a stretch to think that we're ready to have that conversation with the public, but we need to stand united. We need science and we need social science to explore, to discover, and to design our response to new health threats. Hopefully, you, like we, have already started discussions about how social scientists can be a part of this emerging scientific challenge. We started with simple, theoretically driven advice to family physicians. That first step is opening clinical doors for us to continue investigations into physician and patient perceptions of emerging evidence and treatment guidelines.
Today, as the nation faces a pandemic crisis, it's important to take a look at how we, as social scientists, can make an impact on our audiences. There are a few ways social scientists, and not only those of us who study communication, can benefit from using the strategies that come from risk communication literature. We're going to discuss just a couple of ways you can benefit from that discussion today. The first is that we need more social science research on how people understand science. We should challenge the notion that trust is as important as expertise, as we're seeing easily discredited sources providing information to publics that is then trusted. We also need to explore why people distrust science. We have past examples of why this is. We understand that the Tuskegee incident led to a distrust of scientists by African American communities. However, we're seeing more people from other racial groups distrust science as well. We have to question why this is. As science becomes more advanced and more accessible, we're failing to capture the trust of those who need to believe in that science. So what can your organization do to help improve our knowledge about how people understand science? Are there researchers in your discipline focused on this? How do you get information to your members or to your members' publics about what is credible and what isn't? How do you explain credibility, and how do you work to bolster your own credibility? And how can you use your stature and inherent credibility in the social science field to improve trust in science? Second, we need better interdisciplinary communication. We do a good job of talking amongst like-minded others. Those of us who study communication easily get our research results to others in our field. All of us can publish interdisciplinary journals, present at conferences, and serve as expert panelists. But what does that research do? What difference does it make inside a vacuum? We need to do a better job of including others in the conversations about science, about research, and about how social science can help in the dissemination and translation of science. Scientists aren't trained to communicate to a lay audience, so it's up to us in the social science disciplines to make that harder to digest information more palatable for our publics. It is also important that we know what each other are doing. It's important to my work in risk and health communication, for instance, to know what psychologists and sociologists are working on in similar contexts. Often we're all working to solve the same or similar problems, but we're not combining resources or even talking about best practices for sharing information. Sharing information both with one another and with our publics is hard during a crisis situation, but it's ever more important. So how can we as social scientists do a better job of this? Is it possible to create a repository of translational research that people of all social science fields can access? How do we create translational research? Do we ask scholars to write a translational piece each time they publish research? Or do we continue to rely on third parties to create this translation for us? What does your organization do to help your publics digest complex information? We need to put aside the notion that just because we have access to knowledge, that people are going to listen to what we say. Instead, we need to figure out how to get our audiences to be more discriminate consumers of information. We need to figure out how to get them to comply with expert advice. We need to work on increasing efficacy so people feel like they can make a difference. And we need to do a better job of managing the outrage that Christy talked about and turning that outrage into sustainable action. We've given you some tools that can work in risk situations like the one we're in today with COVID-19. Risk communication theory provides a new framework for exploring pandemic crisis and the communication of behavior strategies that can help us reach out to audiences with appropriate messages. In fact, prior to our piece due out next month, the COSSA model had not been applied to virus or pandemic crisis. So these risk theories, while helpful in impacting this current situation, are ripe for application in new contexts, even outside of a pandemic crisis.
Exactly. So let's start building some interdisciplinary collaboration today. We're going to move into questions now, and we're certainly here to answer any clarifying questions you have, but we're really anxious to hear and talk through what research ideas or opportunities we have sparked today. Let us know what you're already working at. How can we be partnering together, and how can we be addressing these questions that Lakeisha asked?
Thank you.
Wonderful. Thank you so much. This is Wendy again. And that was just incredible and gave us a lot to consider. And, you know, I invite everyone on the line to certainly weigh in today in today's webinar, or be in touch, because we do want to hear, as I said earlier, all of the ways the social and behavioral science disciplines are tackling these challenges, and there's nothing like a crisis to really shine a spotlight on the work that really needs to be done. So thank you for that comprehensive yet quick tour of what's going on in the communication disciplines. I don't see any questions coming through the chat right now, but one topic that keeps coming to me over the last several weeks from folks from a variety of different disciplines is they want to know, what's the deal with mis and disinformation. And you touched on that sort of more on the proactive side. What can we all do to make sure that we're receiving the information that we need, and that we're interpreting it the right way. And I know this may not be your specific areas of work, but from your discipline and from the NCA's perspective, can you say anything about what you're observing in sort of mis and disinformation? Anything that has surprised you, and is there anything that associations from some of the other social sciences should know or can do to help in this regard? I think on the line today you have representatives from a wide range of disciplines, and I'm sure they're all fielding questions as well from their memberships about this issue. So any advice that you might have there?
This is Lakeisha. I can't speak for my association. I wouldn't want to speak on behalf of our members, but just from what, anecdotally from conversations that I'm having, one thing that is really interesting to me is how politics play into what we understand and believe to be true about science. And I think that is becoming more apparent right now. I've talked to some people who have, my godfather, for instance, he has one news source, and it's been amazing to me how little he knows about the virus. He wasn't aware of protective measures, how many people were estimated on that, every day that chart's a little bit different of how we estimate death to look in, about August. And if we don't take mitigation efforts, then what's that going to look like in August compared to if we do? He just wasn't aware of those things because his news source is very different from mine. And that's not to say that one is better than the other, but it's definitely impacted the way that he gets his information and the way that he believes the virus is impacting people, and he doesn't see it as scary or dangerous as perhaps I do. And that has really stood out to me. I've had conversations with several people who have different sources of news than I do, and it's just been very interesting, the misinformation that I've heard from people. And you really have to kind of think about the way that you respond to that, because you want to be supportive, and you also don't want to increase that outrage about something that they are, they may be dealing with. Maybe they are taking some mitigation efforts, like maybe they're wearing a mask when they go outside, but maybe they should be doing more because they're going outside too often. So you want to be supportive about what they're doing, but there's a fine line that you have to walk between kind of preaching at them about something and providing information that is useful to them. So that's been a challenge for me, and it's something that we've talked about in communication for years. Certainly that's something that's increased in the amount of research that's been focused on it, misinformation and how we challenge that. It's getting a lot of research coming out of that in crisis communication and climate change communication about how we address those conversations. I was at a panel in Montana where we were talking about climate change communication and how some people just don't believe that it's a thing. And their suggestion was just keep talking about it, meet people where they are, but continue to have that conversation, because eventually, whether they hear what you're saying in that moment or not, they're going to get a negative information, and they're going to be like, oh, maybe that person was onto something, and maybe they look at it a little differently, or maybe they start to find a different way to get information, or maybe they just put a little bit more stock in something that a different source is saying. So I think it's important for us to continue having the conversations about what we need to do. And, part of fighting misinformation is making sure that you're providing the right information. And sometimes that can be uncomfortable. Finding the best way to meet that person where they are is probably the best way to go about that. And every person's different. Every person's got a different way of looking at how the virus impacts people, and whether it's as deadly as people say that it is, or their own ideas about their mortality. So, we really have to work hard to figure out where people are in a mental space and what they're likely to be able to hear. If they're very outraged, if they're very upset right now, they're probably less likely to be able to hear those messages. If they're concerned, if they're cognitively processing information, then they're probably more likely to be able to hear that information and probably more likely to respond to it. So I think a lot of it is figuring out where people are.
This is Christy. I'm just going to add to that from our perspective, from a clinical perspective, we certainly see a greater need today than I'm going to say than we've ever seen, for a greater need for science literacy. The conversations that our physicians are having with patients, that are negotiating recommendations, that are navigating this misinformation that patients are bringing into the clinical space, a lot of it needs to be a discussion that's founded on a common understood science literacy. So for a lot of our physicians, they're having to take a step back, and we're working on training programs for them to help them have those conversations. But it's a conversation that's hard to have in an 8-minute primary care appointment. So, I think I speak to the whole social science community in saying, we just need to be boosting science literacy across the board. How can we help the public know how to read and understand science? And then we'll have a common language that we can speak about.
I just want to add to what she just said. I teach a health literacy class, and I have my students go into a hospital, and all of them are English speaking, my students are, but they need to go in and, as best they can, try to get their way around the hospital and figure out where things are and how to manage certain tasks as if they can't speak English or as if they can't read the signs. And it's always interesting for them when they write their reports on that to, it's the word I'm looking for is escaping me, but it's always interesting for them because they don't think about it in that way. And they've come back and they've said, it's crazy just how many people wouldn't be able to understand messages and signs. And a person mentioned once in their report last year that they could figure out what was going on by looking at the signs, like the visual sign. Like they knew that the point was to cover your mouth and to put your nose in your elbow when you sneeze. But they didn't actually know what was being talked about because it was in a language they didn't understand, but they could kind of figure out what was happening on the sign. So it's interesting that even my students can come back and say, literacy is a problem in this country. It's not just, can we read, but can we understand what the information is? Even if there are visual aids, do we understand what's happening? And, the answer for most of them always is no, that if you can't navigate through a health situation where you can ask the right questions and the right questions to ask, and you already have some sort of understanding of the healthcare system and certain illnesses, that you would be pretty much lost. And I don't think that we think about that as often unless we're put in that situation. So I think that, echoing what Christy said, literacy is a huge issue.
Thank you. Okay, nothing in the chat box, but I will encourage folks on the line to either ask a question or to simply share at their, as was requested by our speakers, anything from your associations or disciplines that you would like to share. Until I see some hands go up, or you simply unmute yourselves and interrupt me, which would be totally fine. Let me just go through a couple of final things here. So as I said, we like to finish with a homework assignment if you wish to stay engaged. And so here are some things that we've identified this month that you can partake in. Of course, most important right now, stay safe, follow the guidelines of your community, that is most important, no matter, you know, whether you're working from home or you don't have that luxury. Take care of yourselves. We also hope that you will give some thought to the questions being asked by the Science Committee. Again, they're interested in feedback by this coming Monday. COSSA will be submitting comments as well about sort of the unique challenges of the social science community, but also the unique research opportunities in light of the crisis. You could send ideas that you have to us and we can incorporate them into ours, but either way, give some thought to if there was some research related language in a future supplemental, what would be most useful to our community. And similarly, send any resources that you have either from your organization, if your association or university has set up a COVID resource page collecting information, share that with us. If you have notable sort of media publications or other things that you think folks would benefit from if we were to share them publicly, send those our way. You can send those to Ben and we will collect them on our resource page. One thing I didn't talk about, which we usually talk about, is Social Science Advocacy Day. And as one might imagine, that didn't happen on March 30th and 31st here in Washington. And instead, we've moved that activity to virtual. We still have quite a number of advocates who will be having Zoom-like meetings with congressional staff. It's not as good as in person, but it'll still be really great. And we've changed our messaging. We don't think it's appropriate right now, outside of very specific discussions about supplemental funding legislation, to have our hand out and ask for increased research dollars when congressional staff are very busy, you know, working on all sorts of other more immediate pressing things. So we are using Social Science Advocacy Day to make the connection between the science and the needs of our policymakers. So while our handouts and our leave behind materials will still include our appropriations asks for the year and what we hope will end up in appropriations bills, we are hoping that the discussions themselves will be all about why social science is needed now more than ever, and to make the connections for our disciplines and our researchers and our institutions as resources to policymakers. I mention this because on the one hand, many of you will be participating in Advocacy Day, but also we will be having an action alert issued for April 28th, which is the day that our virtual meetings will be happening, where we invite anyone who's not involved in that activity to reach out to their policymakers and have similar conversations. Send an email, make a phone call, talking about why social science is needed now more than ever. So put a little alert on your calendars for April 28th, and you'll receive more information from us in the coming days and weeks as we head towards the end of the month to prepare you for sending those messages to the Hill. I also wanted to flag that you know, we hold headlines monthly, and the next regularly scheduled headlines is scheduled for May 14th. And again, we're hoping to use the deep dive topic to highlight something else happening in the social sciences that's incredibly timely to the current pandemic, but also save the date, because assuming we have other speakers from your associations and elsewhere, we would like to increase the frequency of headlines, at least for the next couple of months, to get as much of this really useful information like we received today out to our community that can use it. So we're tentatively holding April 23rd for the next sort of bonus headlines relative to coronavirus. And of course, share your ideas for potential speakers or topics with us before then. A quick reminder that if you missed previous headlines, web chats like this, we do record them. We recognize that this day doesn't necessarily work for everybody each month. And so on the screen there are just the topics that we've covered over the last 12 or 14 months. In case you couldn't make it, go to our website. You can find the recordings and the slides there. And of course, word of mouth is the best way that you can help us out in promoting COSSA, in headlines, our Washington update, whatever it is. So please do share this information with your colleagues. Make sure that you're receiving our updates directly into your inboxes. There are materials that the general social science policy and research community receives. And then there are very specific resources to our members. And this webinar is one of those resources. So if you're not on our members only website, or your colleagues aren't, and they should be, do let us know so they have first notice of things like this. And of course, we always welcome your ideas for additional new COSSA members to help increase our reach. Okay, I'm checking the chat box. I don't see anything. I don't see anybody with any raised hands who would like to be unmuted. So we will leave it there and let you get back to your busy days. Please don't be a stranger. Let us know what we can do to help. Let us know if you have questions for today's speakers that we can pass along to them. But more than anything, take care of yourselves. We hope that we get to see you all in person again somewhat soon, but until then, take care, be well, and let us know how we can help. We'll talk to you soon.